I'm Dr. Christo Zouves. I am an RE. I've been practicing in Foster City for the last 20 years, and I'm now the newest and proudest member of HRC Fertility. I went to the University of Cape Town, where I did my medicine. I did 2 years of military, which was compulsory at that time. And thereafter, I went to the United Kingdom, where I did my boards in general surgery and OB-GYN, having done both residencies. When I first went into medicine, I realized that I had to do some branch of medicine where you could have an action and you could have a result in a short time. I wasn't into waiting years and years for a result. I did 2 residencies. I did residency in general surgery. I did a residency in OB-GYN, and I did 2 fellowships. I did my boards in general surgery and in OB-GYN in London. General surgery offered, the really quick fix. You have a lump, you remove it, patient gets better, and off they go. For me, reproductive, endocrine, and infertility had the perfect blend of instant gratification, where somebody comes to you, you solve a problem, they have a baby. It also has the technical aspect of egg retrieval and transfer, and it has the intellectual side of the endocrinology that is required for stimulation and harvesting the best eggs. It still fills me with wonder and amazement every time we get an update on a birth, on somebody going to preschool, going to high school, going into college. This is not just a job. It's a way to do something for a patient or a couple that's forever life-altering. I always like to approach it the way I would like a caregiver to approach me if I had the same problem. What I explain to people is that we're not going to jump straight into the science. It's really important to start with optimum health. And optimum health is the beginning of everything, not only reproduction. So we have to eat right, we have to take supplements, we have to drop the alcohol, we have to drop gluten and dairy, we have to exercise, we have to meditate. We really have to work on that side of it first. So, we're not going to rush. We are not going to avoid and not offer the maximum science. We're going to do that in tandem. So I think I like to reassure people that I'm going to listen to them. I'm going to hear what their aspirations are. Some people only ever want 1 child, and that's what they're coming for. Some people want to have 4 or 5 kids. Everybody's aspirations are different. And you also have to give people the space to change their minds because, sometimes based on certain treatments working or not working, people need to be flexible and change, and people do change. And it's my job to help people not only look at the intellectual side of their decision, but to factor in the heart as well, because a lot of these decisions amount to basically a debate between the head and the heart. So, having been a solo practitioner now from 99 to 2025, I'm 73. I plan to work for at least another 5 years. And for me, this was absolutely the most perfect marriage. HRC Fertility, I've known the players in HRC, the physicians, for years and years. Many of them I've never met, but, I've conversed with them. We've looked after patients, between us. So for me, it really is the perfect segue to, finishing my career here, because for me, HRC has so many people doing all the jobs that I used to have to do all myself. So for me, it is just so exciting and so liberating that I can now focus 100% on patient care. For 20 years, I've worked 7 days a week. I take all my own call, and this for me is very special. And having worked through the night doing deliveries, doing general surgery, is not a chore. People think, oh, well, you never go on holiday. For me, it's not a chore, because it's more than a calling. It's just a way of life.